are welcome. Welcome back. And how is everybody doing?
Good.
I hope we're good.
Yeah.
Okay, so did you do some readings? Did you do the assignments?
Yeah. Some of them have.
So, okay. Now, for the next 10-15 minutes, okay, I want to entertain your questions. Usually when people come back, first day, they may not have a lot of questions, but second day, they come with a lot of questions because they will have done some reading, they will have looked at their notes, they will have done some personal research. So most of the times they have a lot of questions they want to load off from their minds. And it is always a good thing to ask those questions. You don't have to go home with them. Okay? The reason why you are here is to learn how to save life. So you need to know a lot. So it will not be a good thing at all. Not a good thing if you have a question and you didn't ask the question and then you go home with those questions for maybe next 3 years when you come back to take the course. So I encourage you to ask any related question, any question. Yesterday we spent some hours talking about first aid, the role of first aider, the objective of first aid. Why is it necessary? Why do you have to bother? We covered some interesting topics. Remember, we also covered the emergency scene management, right? Remember, emergency scene management, right? And I told you yesterday that this is the foundation. Okay, this is the foundation of first aid. Okay, and after we built the foundation yesterday, we started building the house when we consider the number of emergencies and how to respond to them, how to recognize that that is an emergency and what to do to help the person. Remember, that is what first aid is. The basic care you give to somebody in need, somebody who is ill, somebody who is injured. Okay? And remember that the 3 objectives of first aid, which are your roles as a first aider, you have important roles. So those roles are the same as objectives: to preserve life, the life of the patient, to prevent injury or more injury, and to promote recovery. Okay? And we covered the obligations of the first aider. Remember the 5 obligations. So whenever you do first aid, it doesn't matter where, it doesn't matter the location, it doesn't matter the age of the person, whether it is a baby, child, adult, it doesn't matter. There are 5 obligations. Number 1, use reasonable skills. So you must be sure what you are doing. The skills you use. When we talk about skills, we're talking about those things you do during first aid. For example, if somebody has cardiac arrest, the skill you should use is what? Chest compression and breathing for the person. Okay? If somebody has asthma, remember asthma, the thing you should do, right? The thing you should do. One of the things you should do as a first aider is to tell the person to lean forward. And that is called what? Tripod what? Position. Tripod. So when you lean forward, it will expand the chest cavity. And then it will make breathing easier. Remember that when somebody has asthma, breathing is a problem. So you must use reasonable skill. You must know what you are doing. Okay, whatever you do during first aid, somebody is bleeding, what do you do? Somebody is experiencing medical shock. Remember medical shock we covered already. Somebody, medical shock is when there's inadequate delivery of blood, oxygen, nutrients to the vital organs of the body. We covered all those. And then if you are there as a first aider, what should be the reasonable skill there? Okay? You call 911 because that is life-threatening. Okay? So while waiting for 911, you begin to do some first aid activities. Put the person in a supine position. Remember, supine position is when somebody is on the back and then facing up. And then you take a blanket, remember yesterday, and cover the person, okay, to maintain the temperature of the person. Okay, you cover the person who has a shock. Those are reasonable skills. Don't give this person anything to eat or drink at that time. Those are reasonable. So use reasonable skills when you do what? First aid. Remember that you should not go outside the scope of first aid. Don't go outside. First aid is basic. You are not expected to do advanced care. If that emergency demands advanced care, then you need to call paramedics. You need to call 911 so that they will come with more advanced care. But for us, ours is to do what? Basic. And that basic care is very important. Okay? Very, very important. First aid is very crucial. Because when you call 911, they don't fly. It takes some time. So at that time, in between, when you call and when the paramedics arrive, that is the space that first aid should occupy. So you must stay with it. Don't go outside first aid scope. Keep it simple. Don't use chemical. Don't use chemicals when you do first aid. Medication is not first aid. Medication is a higher care. So during first aid, you are not expected to give medication unless you have authorization. Sometimes the paramedics can even give you authorization. For instance, somebody is having a heart attack and you call 911, you describe what you are seeing. Okay, you describe that this person has chest pain and that chest pain is radiating to the mouth. The person is sweaty. The person is experiencing shortness of breath. The person is feeling like throwing up. The skin color doesn't look good. So these are all signs and symptoms of heart attack. So the paramedics may ask you, do you have aspirin? Can the person chew it? Can the person swallow it? And they can actually authorize you to give the person. So you have authorization in that case. Otherwise, you must keep it basic, simple. So that is number 3. Number 4 is that you must obtain permission. You must obtain permission from the patient. So before you start helping the patient, you seek permission. You introduce yourself. I assume that the safety is granted. You have already done the scene survey. You have already surveyed the scene. And it is